Well, Marcouluigi Corsi is a UNICEF representative for Lebanon and joins us live now from Beirut. Marcouluigi, thank you very much for your time. Now, talk us through, first of all, if you will, the humanitarian situation on the ground. We were hearing from Priyanka a moment ago. She gave us some details. But as a UNICEF representative, in particular, focusing on Tuesday, talk to us about the situation there, as we're hearing reports of over 760,000 people now displaced so far by this war. Just how critical is this unfolding crisis?
Right. Now, good evening. And indeed, as we speak, the numbers continue to increase. We are actually just received the latest bulletin from the government, and we are now talking about more than 800,000 people displaced, out of which a fraction, about 125,000, have been accommodated in temporary shelters. And those shelters are the ones that we are talking about, is around 590, yes, which has been mainly set up by the government, and they mainly schools. So the majority, indeed, of people who are on the move, they are actually outside the shelter. I think the critical element is that the movement of people actually happen in a very short period of time following the evacuation order in different parts of the country. So the challenge now is to make sure that the institutions which are providing the immediate assistance to the people on the move, they actually have the capacity to respond. So far, UNICEF, for instance, has been on the ground from the very beginning, triggering the response mechanism, which include really immediate assistance to the basic needs, which comes from, which is basically water and sanitation. We need to think about that. People, whether they are in shelter, outside the shelter, they are living in crowded places where they have to face really basic water needs, sanitation needs. At the same time, we really trigger the protection mechanism. We need to think about the most important thing when it comes to the children. The children remain united with their family. We also need to think about the psychological trauma that these kids are going through, and including the families. We should not forget about the fact that 18 months ago, only 10 months ago, most of these people, they went through the same kind of trauma. It's for them, it's really a deja vu. When you visit shelters, you talk to them, you see they are completely lost. There are people, there are children you talk to, and they're exactly in the same shelters which were 18 months ago. So the psychological support to avoid trauma indeed has a major role to play. Of course, the food assistance, meals, water bottle, drinking water through water tracking is also indispensable. And now that we are in the second week of the response, we need to think about a little more the medium-term response. As I mentioned, most of the schools are accommodating those people displaced, but this means that the schools are actually closed. And we need to think about the continued learning for children. So together under the leadership of the government, together with the Ministry of Education, we are already setting up now education hub, temporary learning space, so the kids, they continue, go and learning, but also creating a space, an environment where children, they feel protected. So a little bit going back to the normal, although normal doesn't look like.
And Marcouluigi, you've already mentioned in part just how much this country is suffering economically, but given the situation there, how is the government coping, and what provisions are in place, and how is UNICEF operating in these conditions? Are you able to deliver aid and support hospitals, schools, and all of the families that are displaced, or what more could be done?
Indeed. So when it comes to, first of all, we are really supporting and scaling up the capacity of the government across the different sectors like health and nutrition or education to cope with the challenge. For instance, we have set up and mobilized our primary health care units and the mobile units, which goes around the town, the cities, and the affected areas to make sure that when it comes to children continue to be screened and continue to be vaccinated. At the same time, we should not forget about that some of the people who are on the move, they also needs support in terms of medicines because they are affected by chronic diseases. So we need to make sure that those diseases were well taken care of. The Ministry of Health assure that for the next 6 months, they will have the capacity to provide a kind of medicaments, health services. But of course, we need to think about that. We don't know when this will be de-escalated, when the violence will stop. So we are the important thing at the moment is to boost the capacity of the institutions by mobilizing partners that they can continue to provide the services after the responding to the immediate needs. This is not easy in a way. We have been able to do so because we have, for instance, in UNICEF, we have the preposition capacity when it comes to supplies in country across the different areas of the country, but coming 3 months from now, we need to replenish those supplies when it comes to hygiene kits, when it comes to the education kits, child protection elements, sanitation kits. So we see that unless there is a mobilization, and by the way, Turkey just sent their first flight of relief, which I think landed yesterday, unless we see a mobilization of the international community to provide support to the government and to the partners on the ground, then it will be very difficult to address the medium and long-term services for the people affected.
Marcouluigi, thank you very much. Really appreciate you talking to us here at TRT World.